CNS stimulants, psychomimetics, and cognition enhancers. There are so many drugs which can stimulate the central nervous system. The stimulation of various brain areas may depend on the dose, which is not yet very clear. Stimulation of a particular brain area may be utilized clinically, such as respiratory stimulation, which are already being used. And many other drugs produce central nervous system stimulant effect as their adverse effect, or some of them may be so toxic that may cause convulsions. And the clinical use of these agents as central nervous system stimulant is not yet established, rather it's a controversial thing. However, some of them are used clinically, and let's see them one by one. There are so many neurotransmitters which have their particular functions in the central nervous system also, and the combination of them is here. Let's see. Central nervous system stimulants act via increasing alertness and wakefulness, and we call these drugs as psychostimulants. They can also stimulate the centers. One of them is respiratory center stimulation, and the drugs are called as analeptics. They can increase psychic or mental condition of the person, and these are known as psychomimetics. They also increase learning and memory. So these drugs are known as cognition enhancers or nootropics. And last but not the least, they can also increase motor activity via central nervous system, and along with that, if more excitation occur, then convulsions may occur, and we call them as convulsants. So let's see one by one. First is psychostimulants or psychomotor stimulants, also known as. So if we see the classification, there are amphetamine group of drugs in which we have amphetamine, dexamphetamine, methamphetamine, MA, methylene dioxyamphetamine, that is MDA, methylphenidate, and phenfluramine. Then there are non-amphetamine groups like modafinil, atomoxetine, sibutramine, and pimoline. Then there are certain methylxanthines in which we have caffeine, theophylline, theobromine, and last but not the least, cocaine, which is well known to everyone. Let's see amphetamines and non-amphetamines, along with they have almost similar type of effects. So their pharmacological effect is in the form of increased wakefulness, increase alertness, excitement, and euphoria in the person. They also increase the motor activity, and they reduces the fatigue, and they will lead to anorexia or loss of appetite. So the person become more active, and in fact you can say he becomes hyperactive, just like a person occur in a mania. But there are certain stereotyped and psychotic behavior has also been seen with these drugs on prolonged administration. For the person become more confident, more talkative, hyperactive, and sexual desire is also increased. So these are the certain pharmacological effects. Then if we see on the basis of these pharmacological effects, there are certain therapeutic uses also. Like this can be used in ADHD, that is attention deficit hyperactivity disorder, which is a childhood disease of hyperactivity and inability to concentrate and impulsive behavior in case of kids. The kids start shouting on everyone. There is loss of concentration in class. So to treat these conditions, these CNS stimulants can be used. So just like dexamphetamine, methylphenidate, atomoxetine are quite effective drugs in this condition. Second, this drug can be used in narcolepsy, which is also known as sleep attacks. There are vivid nightmares and excessive daytime sleepiness is there in narcolepsy. Then there is one more condition known as cataplexy, also similar condition in which there is sudden loss of muscle tone. Like first there is a strong emotional trigger, whether it is excess of happiness or excess of emotional sad kind of emotional behavior is there. And then there is partial cataplexy will lead to ultimately incomplete cataplexy, and there is loss of total muscle tone of the body. And if the treatment of the condition is modafinil and methylphenidate. Third use of amphetamines or non-amphetamines are for appetite suppression. So earlier phenfluramine and dexphenfluramine were used, but tolerance to this effect developed within a few weeks. Along with that, there are certain side effects like insomnia, pulmonary hypertension, abuse potential also discourage their use in weight control or obesity, and this is also contraindicated with SSRIs, that is the antidepressant. And in depressive patients, most of the time obesity is also associated, so both the drugs can't be combined, so this discourage the use of fenfluramine and dextroamphetamine. So for suppression of appetite, the drug which is used nowadays is sibutramine. The mechanism of action of these CNS stimulants are that amphetamines are usually act in as the sympathomimetics. Now they displaces dopamine and norepinephrine from the vesicle, and hence they increases the level of monoamines at synapse level. So their effect will or you can say the peripheral effect of these drugs will be just similar to the sympathomimetics, like increase in blood pressure, reduced GI motility, so constipation and arrhythmia will also be seen with these type of drugs. Other names of amphetamines which has been given to these drugs are like speed, Billy Whiz, poor man's cocaine. If we see the side effects, this is first and foremost which will develop for these is tolerance. Now the tolerance will develop fast for the peripheral sympathomimetic actions like increase in blood pressure, heart rate, constipation, like them. And the tolerance development is slow for the central actions like euphoria and motor activity or hyperactivity. And the mechanism, if we see for development of tolerance, is just like sympathomimetics, these drugs are responsible for anorexia. So if anorexia occur, then ketoacidosis will ensue. With the ketoacidosis, there will be increased excretion of basic drugs, just like amphetamines. So with their excretion, their plasma level reduces, and thus the patient increase desire to take amphetamines to get euphoria. So thus how the tolerance usually develops. The second side effect is dependence. Usually with amphetamines, there is only psychological dependence. There is no physiological dependence with amphetamines. The third side effect is occur at higher doses, usually in the form of convulsions, psychotic manifestations, cardiac arrhythmia, coma. These are almost the sympathetic side effect will also occur along with them, and these side effects are treated with the help of diazepam, haloperidol, gastric lavage, urine acidification, as these are the basic drugs, nifedipine and labetalol or esmolol. Almost all the drugs act symptomatically, like diazepam are for convulsions, haloperidol is being given for psychotic effects, gastric lavage is for the poisoning purpose, the nifedipine and labetalol reduces the blood pressure, and esmolol similarly reduces the arrhythmia. Then sudden death can also occur. Drugs like MDMA usually leads to heat stroke, and rhabdomyolysis will lead to renal failure. So death can occur with MDMA. Then MDA has its own side effects. This is also known as love drug. It is almost similar to MDMA. At the dose of 75 milligram, there are psychomimetic effects like feeling of closeness to each other. That's why this drug is known as love drug. Then at dose of 150 milligram, LSD-like effects are there. Then dose of 300 milligram, amphetamine-like psychotic effects. And these are psychotic effects, and these are in the form of side effects. Now moving on to the second group of CNS stimulants or the psychostimulants. These are methyl xanthines. These are found in xanthine containing drinks like coffee, hot chocolate, coke. So caffeine is present in almost this type of beverages. Theophylline is present in tea, and theobromine is present in coca. So xanthine containing drugs are the theophylline, theobromine and caffeine. If we see the mechanism of action, these act via inhibiting phosphodiesterase, which will ultimately increase the level of cyclic AMP, and hence these drugs are responsible for bronchodilation. And the second mechanism by which methylxanthines act are, they are also inhibitor of adenosine receptors. There are three types of adenosine receptors are there, and the main function of adenosine receptor are homeostatic. They basically protect the neurons from damage. They are also anticonvulsants. They are cardiac depressants, reduces the motor activity, reduces anxiety, increase the sleep. So basically they are CNS depressant type of drug, and inhibition of the depressant will lead to excitation. So benefits of these methylxanthines over amphetamines, why these are preferred over amphetamines, are that there is no locomotor stimulation and there is no euphoria, so chances of abuse is less with these drugs. There are no stereotyped behavior or psychotic manifestation are there with these drugs. They do not increase the blood pressure. In fact, they are bronchodilators, so they favors their use in asthma. And they also constrict cranial blood vessels, so they are used in migraine type of conditions also. Let's see their uses. They can be used in migraine as they constrict the cranial blood vessels. Caffeine along with aspirin is used. COPD and asthma, usually theophylline is being used. Apnea in premature infants, caffeine or theophylline can be used. In case of paroxysmal dyspnea along with left ventricular failure, usually aminophylline along with oxygen is being given. Now you have to note down that when distinction between cardiac asthma, that is dyspnea due to left ventricular failure, and bronchial asthma is doubtful. Now it is safe to use IV aminophylline than the adrenaline, as adrenaline can increase the heart rate and type of condition in case of cardiac asthma, which can lead to severe conditions. So it is better to use aminophylline type of condition if you don't know what exactly the asthma is of type. Let's move on to the another stimulant, cocaine. So if we see the history, cocaine was initially being used for hair softening, for the Coca-Cola syrup in case of toothache, as this is a good anesthetic property. This also contain a good anesthetic property, so for toothache also it was being used, but later on it was diagnosed that it has high abuse liability, so their use was prohibited after that. So what exactly cocaine is? Pure cocaine was first isolated from the leaves of coca bush in 1860s. Contained in small amount in the leaves of erythroxylum, that is coca bush. Researchers soon discovered that cocaine numbs whatever tissue it touches. So it's a very good anesthesia. This led to its use as a local anesthetic. Now, for at least 4,500 years, people in Peru and Bolivia have chewed the coca leaves to lessen the hunger and fatigue, and it has highest abuse liability. Although it's not the commonly used drug which can be abused, but it itself has highest abuse liability. Now, how it can be used? It can be sniffed, which gives effect in 15 to 30 minutes. It can be smoked, which gives effect in 5 to 10 minutes. It can be injected, which gives highest rate of effect. The speediest is 3 minutes. There are short-term effects in the form of dilated pupils, as it is also a sympathomimetic, so people get dilate. Increased body temperature, blood pressure and heart rate, insomnia, loss of appetite, increased energy, reduced fatigue, mental clarity and talkativeness. So person become hyperactive in short-term effects. But with the long-term effects, there are paranoia, psychological condition, there can be depression, ulcers in the membranes of nose because of excessive sniffing lead to ulceration, dull senses of taste and smell later on, weight loss, poor health and sexual dysfunction, loss of social and financial supports, and holes in the bony separation between nostrils and nose. This can be the MCQ, and it has been asked many a times that cocaine may lead to holes in bony separations between nostrils and nose. Now, what is formation? Because it's being attached with the cocaine. Skin sensation that feels like ants or insects crawling on your arms and legs underneath the skin is known as formation, and this is the characteristic feature of cocaine abuse. Cocaine along with heroin was being used earlier, and it is known as speedball. This is the drug of abuse. You can see here the picture of various at various ages of people before being on cocaine.